Okay, great. So today, this is one of the practical sessions, and for Adapt and Advance, and I will be talking about a very practical topic. I get this question a lot, both from patients, loved ones, friends, family members, and it's a question I've had to answer so many times, and I've decided, okay, I'll put in a video. Hopefully, it benefits somebody today. And the question today, or the topic today, is: do faith and medications mix together? Do faith and meds mix? And as early back as very early as a medical student, this question has always been something I wrestled with, or people had for me, and had to figure out the best way to answer it. Um, Personally, I'm a person of faith. I believe in God. I'm a Christian. You can tell from my videos. But also, I'm a medical doctor too. So, uh, do faith and medications mix? And I will start with the story of someone as far back as 20 years ago who is a Christian, goes to the same church with me, and she asked me, she came to clinic, she was not taking her medications, her blood pressure was high, and she confided in me that, she's using faith, and that's the reason she's not taking her medications. The reason she confided in me, maybe she wouldn't have said that to other doctors, was she felt I was of the same faith and I would perhaps understand her and if possible encourage her, which I did. But I had to also figure out what's the best way to help her professionally as a doctor. So I told her something. I said, do you have a Spig in the house to check? Or a blood pressure machine is what I mean by Spig in the house to check your blood pressure? She said no. Okay. So I said, okay, this is what I would recommend. Both as a person of faith and as a doctor, I said, look, get a blood pressure machine, okay? It's cheap on Amazon. You just go to wherever store where things like that are sold and get one. And check your blood pressure at least twice a week. I don't know, usually recommend it once a week at the most. And I told her the normal values. Systolic should be usually about 120, preferred 90 to 140, and diastolic about 80 preferred, but between 60 and 90 is fair. And I wrote it down for her and I said, check it at home. If you check it and it's within this normal value, then your faith is working enough. If it's not, that means there's something else you need to do. And I educated her. I said, listen to me, God gave us knowledge for a reason, and God made doctors possible for a reason. So she took my advice, and that was it. The objective measure of her blood pressure made her understand that she needed to do something. And eventually she was able to take her medications. Her blood pressure was controlled. I also told her the complications of not taking meds, what can happen to your body, to your brain, and the entire body with very high blood pressure. And that was how we were able to get through that story. That's just one story I've shared with us. I have so many of such stories. Even now, more recently, I remember there's one of my patients that I saw as early as last month. So I've been seeing him for a year now. He also goes to my church right here in the US, and also had this very similar situation. And I'm like, listen, medications are there to help you, but if you strongly feel you want to try not taking it, we can try. But if symptoms worsen, then you need to take it. I'm glad he came back, and this was a few months later after stopping the medications. It was he's ready to restart it again. I was happy to restart it back for him. So the reason I say these two stories, one from 20 years ago and one from 1 year ago, is I get these questions a lot. In between those two examples, there's so many stories of people who share with me that they do not take their medications because of their faith. So I decided to make this video, medications and faith mix. So using meaning making aim, I want us to know that faith and medications are two unique gifts from God that serve different purposes. And at times, they could serve the same purpose together. So that's where I would like us to make meaning today, that faith is a gift from God. Also, medications are gifts from God. The knowledge to make medications, the knowledge for that doctors have, they are all gifts from God to help us in unique ways. Faith nurtures the soul. However, medication helps with both the mind and the body. And that's why we have made for psych issues, we have made for physical ailment. Like the example I gave you was blood pressure, the other one was depression. So faith can help. At the same time, medications can help. But how do you maximize both without feeling that you taking medication is a lack of faith? Taking action, which is A for MAPLAM, I would recommend, if you are struggling with anything, my take on this is, on one hand, seek professional assistance. And that's why I always say, for example, like, don't take whatever I say out of context. Always check it with your doctor or your primary care physician. Run it by them before you do anything that I say. Even anything you learn generally too. So the A in action today is, if you have any health condition, my recommendation is seek professional. Not because I'm a doctor. I have my own primary care physician too, even as a medical doctor. And I run things. Like I told you in my weight loss video, that when I started doing all of those things, I ran it by my PCP and we both watched things together. And when she felt it's enough, stop going down on your weight, she was like, it's enough. And we did stop it. And I did take steps to remain on that level. It's been almost a year now. I've remained on the same level of my weight, where I want to be and where my PCP feels is safe for me to be. So one, the action is seek professional. If you are struggling mentally, I'm a psychiatrist, seek professional help. Go to a counselor or go to a therapist. So get a therapist help. Go to a psychiatrist if you have to. If it's a physical ailment, go to any doctor that your PCP or whoever the specialist is that you need to see. That helps you on one hand. And the other hand, also, you could activate your faith by praying and by finding a way. And by also even doing things. If I call it a three-legged stool, most of the things I say are three-legged stool. So we have going to a professional on one hand. We have two, prayers on the other hand, and the third leg would be lifestyle. A lot of things are amenable to lifestyle changes. Like I shared with you my weight loss journey in the previous video, that most of what I did were lifestyle changes, diets, physical exercise. They are very important, and they are very important for many other things, many neurological conditions, even psychiatric conditions. Even depression, it answers to exercise. Like I told us about the book, Upward Spiral, that a lot of those things, they move against the downward spiral of depression or anxiety or worries or stress by doing them. P for planning, develop a wellness plan that honors both your physical body, medically, medication-wise, and also that honors your faith spiritually. Both of them can coexist in the same space. There's nothing wrong with them coexisting in the same place. If you feel you can do without medications, or if you don't need it, it's fine. But if you do need it, then take it. Like I gave us the example of blood pressure. I have a blood pressure machine. I check my blood pressure regularly. There was a time I was checking it every day. Currently, maybe once a week-ish. Check it. If it's okay and you feel you want to stop your medications, discuss with your primary doctor, and then as you are stopping it, and make sure you check it every week to be sure you are within where it's supposed to be. But the moment it begins to go high, and you know those complications like stroke and many other things can happen because it's going high, then talk back to your PCP and get back on your medications. But if your faith is enough, and I don't want to use the word enough, if your faith is helping, because faith is always enough. If your faith is helping you, and you don't need medication because your faith has handled it and your measurement is good, then that, praise God, you don't have to necessarily use medications. But if after you've used all the faith you know to use, but your blood pressure is still high physically, then it's time to seek professional help and get back on medications. Like I said, the way I look at it is this: even when Jesus was here, he didn't do all the miracles that were needed to be done. He did a lot, but there were still some that were not done. And we don't, find we can move by faith to move God's hand in our direction, but we don't have all the answers on why God chooses to work miracles for some people at specific times, and maybe not for every single person. If 100 people praise, for example, if all of them don't get answers, we might not be able to explain why some got answers and why some did not get it. But again, that's why I believe God gave us a brain, so that we have doctors and we can also take decisions that can help us. So the long-winded answer to do faith and med mix is yes, they do. We can take faith, we can be a person of faith, and we can also use our medications to help whenever we need it. And also talking about now learning, I would say whatever condition you have, as much as possible, don't live your life in any other person's hand. Fine, the professionals try their best, but it's your life. So I take steps to learn a lot. I have books, about weight loss. I have books about my blood sugar. I have books about my blood pressure that I learn from. And I also have faith books. I have the ones that are written by doctors. I have the ones that are written by people of faith. And I use both together to help me. So I would recommend getting books that can help you in your journey of both faith and wellness. One book I read recently is The Diabetes Code. If you are struggling with blood sugar, I think this is a book to read. It's a must read for people, or maybe diabetes or something like that. Another book I read recently is Cholesterol Down, which are struggling with high cholesterol levels. I recommend it. I was looking for the book I recently read. I can just find it. It's a faith-based book too on divine health, where I learned a lot about the Holy Communion and stuff like that. So you can, both of them mix together. You can take steps of faith, and you can also learn physically from people that could help us. So I recommend faith and medications can really mix. And I strongly recommend that you also learn what it takes to be in charge. And that brings us to the issue of lifestyle. A good number of things, a good number of mental illnesses answers to lifestyle. I cannot tell you how many people, especially young people, that have psychosis, which could easily lead to schizophrenia if they don't really manage it well. That is due to, for example, use of some substances that could lead to that. So it's important for us to know that certain things are better avoided for the sake of our health, if you can avoid them. So we need to learn. So part of it, like I said, exercise, diet, and maybe avoiding substances. All those are lifestyle issues if you can do, or not even getting hooked on those substances at all. I can't tell you how many cancers or even things that are related to where alcohol is a risk factor. Not that alcohol can cause them, but it's a risk factor, especially if you take it in excess quantity. So those are all things you can be mindful of. When you learn about those things, it helps you to put things in perspective and to know what is useful for you and what is helpful for you. So I would say faith is important. Read about faith books that help you with your health, and also read about maybe non-faith books that gives you lessons of lifestyle things you can do to help with your health. So that is it for today. Faith and medication do mix, and my encouragement to you is, If you, for any reason, want to stop use of medication, make sure you discuss with your doctors. Doctors are trained to walk the walk with you, but also keep your appointments with them and make sure that while you are taking those steps, you are checking on things to be sure things are okay. And if you really need to go back on medications, please let your doctor know that you've tested this and this is, you want to go back on your medication. And I would recommend strongly that there's nothing wrong with taking medications if you have to. I have prescription medications I take and I'm okay with it. But also I do everything within my power to make sure I have a lifestyle that prevents those conditions. And what do I mean by that? Exercise, diet, such that even if I have to take meds, I take a very low dose of medications to avoid side effects. One reason people at times don't want to take meds too is generally because of side effects. So if you have, if what you can do in terms of lifestyle can help you not to take meds at all, great. But even if you must take it, use it at all, it's very low dose because you really don't need a high dose to take your medications. So that's my take on meds and medication. Take your meds on one hand, make sure you also use your faith on the other hand. And the third leg is make sure you have a lifestyle that is health promoting overall. Read books for faith people, read books for non-faith people about the things you can do to keep yourself healthy. Health is wealth, they say, and health is very important to keep ourselves moving. We need our health to fulfill our purpose. Don't destroy the body that God has given you. Like there's a Bible verse that says our body is the temple of God. So honor it, use it well, exercise, eat good food. Don't put poison in your body. Don't put things that are not healthy. We have so many risk factors for diseases that you can stay away from. I stay away from, smoking cigarettes, for example. I stay away from taking alcohol because they are risk factors for so many things. Not that if you take them, you have them, but they just increase your risk of certain things. So why increase my risk if I can do without it? So those are my things for today. Watch the video, like it, share with friends, subscribe to my channel if you have not. This is Wale Baba today, bringing you practical health tips today. Thank you.